difficulties. But hopefully now, if you're on your computer, you should be able to see a opening slide for the presentation you'll see and hear in just a few minutes. I'm going to do a brief introduction, and then I'll turn it over to Josh and Tamlin for the rest of the hour. If you have questions throughout the hour, there's a couple ways you can send those. Hopefully in your dashboard for GoToWebinar or GoToMeeting, you have an area that says questions, and so you can type a question in there. I will keep an eye on those as the presentation is going on, and then we'll get those answered at the end. Or there's a chat function, and you can type messages there, either that the entire audience can see, or the alternative would be probably to send it to organizers and panelists only. You can see that just below where it says to type the message that you can change who it goes to. So those are the best ways to answer or to ask questions throughout the presentation. So without further ado, I'm going to make some quick introductions here. Our fabulous panelists today are Josh Smythe and Tamlin Connor, and they'll be talking about experience sampling and ecological momentary assessment methods. We hope this is a useful presentation for many of you. I know that I certainly am looking forward to it. It's a type of methodology that I've been eager to learn. So first we have Tamlin Connor as one of our presenters. She is I think, senior lecturer. Is that right, Tamlin? I was looking for your title. That's right, yeah. All right, senior lecturer at the University of Otago in New Zealand. And she studies real-time physical and emotional well-being, including what sounds like a really cool project combining genetic analysis with mobile technology of, I think, the sorts that she'll be talking about today. And she is, of course, a leading expert in various kinds of ambulatory assessments, hence the reason she is our panelist. Josh Smythe is a professor of biobehavioral health and medicine at Penn State University. He studies the effects of stress on physical and psychological well-being and also implements interventions to improve health and well-being. He is a leading expert in ecological momentary assessment, and in fact is the academic director of the DREAM initiative. Josh, I love that this acronym works out, the Dynamic Real-Time Ecological Ambulatory Methodologies Initiative. So both great experts for our topic today, and I'll now turn it over to both of you.
Okay, thanks very much, Kate. It's we're happy to be here, and so let's get started. This is Tamlin, by the way. All right, so what we're going to do today is start off with some quick definitions followed by rationale. Try not to spend too much time on that so that we can get straight to protocol design and challenges and how to actually conduct an ESM-EMA study, and then we'll hopefully leave about 10 minutes at the end for question and answer session. So, all right, so experience sampling methods. Hang on, let me just move this. Those of you who are not familiar with this method refers to using multiple self-report assessments per day, more recently with mobile technology. And this is a term that's used in psychology, and it was coined by Csikszentmihalyi in the 1970s. And the term experience sampling method used to be more, was originally focused on internal experiences, so sampling thoughts and feelings, what is the content of your consciousness at that moment, sampled over time. And so from this, hang on, sorry. More recently, the term ecological momentary assessment has been used, and so this is an alternative offspring term of experience sampling. And whereas experience sampling really refers to experiences per se, ecological momentary assessment is a term that has extended from focus on internal intrapsychic states to include judgments and measurements of the environment, health, and so on. So the term is slightly broader than experience sampling, but like experience sampling, it involves multiple assessments per day. And it's a term that's more commonly used in the health and medical sciences and was popularized by Arthur Stone and Saul Schiffman. So in health psychology, we're in this funny area that sometimes we use the word term experience sampling or EMA. But really, they're more overlapping constructs and terms these days. So it doesn't really matter what you're using so much. But if you're publishing in a medical journal, using EMA as a terminology is probably more appropriate. So why do we conduct experience sampling, ecological momentary assessment? Well, to capture experiences and behavior in the real world. So this enhances ecological validity and enables testing of what we call place-bound phenomena, so experiences at work, experiences at home, how these may differ, and really it can capture events and processes that's very hard to emulate in the laboratory. So things like extreme pain, so maybe arthritis pain, interactions with spouses and partners that are naturalistic, stressors, so what Josh does, things that are quite difficult. It's really difficult in the laboratory to create a stressor that might be equivalent to what we see in the real world. And so the second rationale is real time. So phenomena, that is behaviors, experiences, are assessed close to the moment that they occur, which reduces recall and reconstruction biases. A really good chapter about that is by Norbert Schwartz, 2012, in a handbook that I'll reference later. So if you're writing grants, you can talk about how these types of methods reduce memory-based reconstruction of experiences. So for example, emotions are very different when they're remembered versus when they're reported at the time. And also these approaches maximize sensitivity for detecting certain patterns and associations. I'll return to this in just on the next slide. And that's particularly important for health psychology. So I'll come back to that. And then over time, so real world, real time, over time, these methods involve a substantial number of repeated observations over relatively short periods of time, anywhere from a day to a week to 3 weeks. And by tracking people intensively over time, this allows for modeling of what are called within-person processes. So how, let's say, emotion and pain change over time within the same individual, and temporal dynamics, so diurnal patterns in behavior, and so on. And really, these three characteristics are the core features of why we do experience sampling. Now, within health psychology, there's also some reason to be doing experience sampling and EMA, and also I'd broaden that to include daily diaries, which is related, where people assess their experiences once a day, usually at the end of the day, because these techniques maximize sensitivity for detecting certain patterns and association. And a good citation for this, not to self-cite myself too much here, but I just did a review article in 2012 with Lisa Feldman Barrett that reviewed how psychological states measured intensively through ambulatory assessment, that is using either EMA or ESM, often show stronger associations with health-related constructs. So cardiovascular and immune biomarkers compared to traditional self-reported traits, where you might just ask a person, in general, how stressed out are you, versus asking them, how stressed do you feel every day for 2 weeks. And some of the evidence for this is in that article. I reviewed studies, for example, by Tom Kmark in 2004, where he showed that a daily assessed, using a daily diary measure of daily stress, was associated with the thickness of coronary arteries. So that's what this graph here is showing, so that people in the highest quartile of daily stressors had the thickest coronary arteries compared to people with the lowest, or who were in the first quintile of daily stressors. But when they measured stress using a global self-report inventory, asking people in general, how stressed are you in your life these days, that global measure of stress did not predict the thickness. And the reason for this is that your coronary arteries are tracking the buildup of your daily experiences, and sometimes these global measures are instead capturing beliefs about things, or stereotypes, or experiences that may not, knowledge that may not necessarily track actual experience. So a couple other examples, not to belabor this point too much, but some of the work in P&I, so psychoneuroimmunology, has shown that if you track positive emotion using EMA or ESM or a daily diary in the week leading up to an experiment where they subjected people to the cold virus, you see that positive emotion, aggregated daily interviews of positive emotion across those 6 days were associated with reduced cold symptoms, whereas when they took a global measure of positive emotion, so in general, how happy are you these days, that still showed an effect, but the odds ratio was cut in half. So often what we see is if you want to get at health-related connections between psychological phenomena and health-related experiences, tracking those psychological phenomena in real time makes a difference. Now, one other subtle point here is that daily experiences are often more sensitive to change. So they can sometimes show change to health interventions relatively sooner than standard approaches. So this is actually good for writing grants. You can cite this Lender King, Hugh Tenon et al. 2008 article, where the black curve shows tracking symptoms of mood on a daily basis, that when people did that, reporting symptoms on a daily basis showed improvements in depression earlier than people reporting symptoms over the past week. So that's over the past week reporting is the red line. So you can actually see an earlier treatment response to depression. Now this is for a antidepressant, but the same logic could apply to, let's say, an intervention assessing pain. So these examples, I think, are very helpful if you are looking for justification for why you might need to use these methods. Okay, so when we're conducting an ESM study, there's three main, I'll just go through all this, there's three main ways that we can model the data. One is aggregating your data over time so that you can get a more accurate snapshot of that thing that you're measuring, whether it's emotion or pain or the number of words that people are using. This is well, I don't want to get into that, but then also modeling the time course, so looking at how patterns are changing over time, and then this within-person processes, the sequencing of experiences. So how receiving social support is related to mood or feelings of closeness, pain, and so on. So those are the three main types of analyses that, or types of questions that these methods can provide. Okay, so at this stage, just rather than summarizing, why don't we get straight into some protocol design and challenges. And here I'll hand over to Josh to develop these next few slides.
Sure, thank you, Tamlin. I think the sort of general issue about switching from your standard lab-based or survey-based design to an ESM or an EMA protocol is just to take a moment and sort of think through who your assessment targets are going to be, and that might be an individual, magnified out to your sample. It could be dyads or families or other groups of non-independent reporters. You want to think about the sort of the temporal granularity and content of assessments, and so you have to give some thought up front into these issues about timing and duration of the processes specifically that you are interested in. And so some things change on the order of minutes, others hours, other days, and all of these need to be really sort of thoughtfully prepared in advance prior to diving in, rather than just sort of extracting some relatively generic measures that others have used that may or may not be applicable to your situation. Tamla, can we advance one? This is, a quick summary, and there's a better version of this in the handbook that we'll provide the full reference for again later. But there are sort of different ways to try to get your assessments, and somewhat oversimplified, the standard sort of signal contingent report is to provide some audible reminder, an alarm, a beep. You could text message them, something to prompt them to give you a response. And typically we would do that when we want to randomly or pseudo-randomly stratified throughout the day capture normative, naturally occurring experiences. So we might send them a reminder in the morning, the afternoon, and the evening to get responses. Another approach is to sort of do it at a fixed interval, and so this might be every hour. Do a pain diary, or when combined with other assessment protocols, you see as an example there that sometimes we would ask people to wear an ambulatory blood pressure monitor that is cued to take a blood pressure every 15 or 30 minutes. we might instruct a participant in one of those studies to give us an ESM or an EMA report contemporaneously with these other interval-based assessments. Lastly, we might ask people to provide information based on their judgment of an event occurrence. So you see some examples there. You know, whenever you eat, when you have an interaction or an argument, you can provide responses. There are some emergent technologies, I will note in passing, that you can base this event occurrence not necessarily reliant on the participant's judgment. So this could be triggered by something automatically as well. So the presence of another person or based on a GPS location. That's a little bit more sophisticated and difficult to implement. I would also note on this that it is not uncommon at all to use combinations of these strategies. So you might, for instance, have that 3 times a day, morning, afternoon, evening, signal contingent supplemented by an event contingent report, particularly if you're trying to capture a relatively infrequent or rare event.
Yeah, just to add to that, for example, I'm running a study right now where I have a signal contingent sampling of momentary mood across the day, and then at the end of the day they have a single daily diary, which would be, I guess, considered a sort of interval contingent, just at the end of the day, so a regular end of day sampling scheme. Okay, here you go, Josh. Next slide.
You know, this again is, it's hard to give sort of off-the-rack instructions for sort of how long they should be, but you know, one easy thing is you can't take your 220 item standard measurement and then ask them to do that 10 times a day for a month. The people will flip out and not participate. So you know, you have to think about adapting these surveys for length, for reporting interval, etc. And at least in my sort of general heuristic, the way I think about it is, what's the sort of the total burden you're asking them to participate? So, you know, crudely you can think about this as the number of individual items multiplied by the number of times per day times the number of days. So these are trade-offs. So if I'm only asking once or twice a day, maybe I can have more items. If I'm doing this for a month as opposed to a week, I might need to cut back. And as a very sort of rough estimate, and again, this is really just a broad heuristic, I sort of think that you should cap your estimated total participation at no more than about 20, maybe 30 minutes a day. And again, sort of you can split that up into different distributions, but that should about be your cap. And as you heard Tamlin mention, you know, if you want relatively frequent assessments during the day, and you feel like, okay, I need to keep those very brief in order to have people be willing to comply with that sampling protocol, you can supplement with additional items that might be a little bit more lengthy, but that are only done 1 time a day. So this again gets to the benefits of using merged or sort of combined protocol designs.
And one other type of design that's being increasingly used is what's called a measurement burst design, where let's say you want to sample people over a 6-month period. You obviously can't do that every single day. That would be very burdensome, but you could choose 3 days or choose a week every month or 3 days every month separated by 3 weeks, and that could enable you to sample over a much wider time frame. Josh, do you want to talk about this?
Sure. You know, we're going to talk through some of the sort of specific software and sort of device solutions that are available to you, and so it does depend on the specific approach you are taking. But what I wanted to sort of point out here is that there are lots of different ways to collect information, and so pretty much anything you could do on paper or on a web-based survey, you can do on a mobile device these days as well. So here are just examples of picking different kinds of response options. You can also display graphics, you can display video, you can have interactive tasks on these, again with some software approaches. And so you can really tailor the item types and formats to be exactly what you need. There's tremendous support in many programs for branching and contingent responding. So again, there are ways to tailor your assessment strategy to your specific needs.
Mm-hmm. All right, so how do you actually do experience sampling or ecological momentary assessment? We've grouped these into three main approaches, and going from the simplest to the most complex. And generally, I don't know about you, Josh, but my philosophy is if you can do it simply, do it simply. So do it however simply, do it the simplest way that you can, and then as you need more features, you can build up from there. What do you think about that philosophy, Josh?
Yeah, I think that's a really interesting point. I think there's no need to gild the lily when it's unnecessary, for sure. I think the one caveat I would add to that is to consider thinking about where you want to end up. And that's simply because changing your method, changing your device, changing your software has some additional time and literal and figurative costs. And so if you know that you're going to need to end up in a certain place and you're reasonably confident about that, I would urge you to start with that, with a system that can ultimately host that end goal.
Right, good point. So as an example, if you knew that you wanted to do eventually combining your sampling with maybe physiological assessment in some way, you wouldn't start off with text messaging, because that cannot be combined with physiological recording. Okay, so let's go into this. I'll start from simplest to most complex, and the first one is to use just very simple short messaging service or text messaging. And this can work on any mobile phone, even the oldest feature phones that do not have internet access. So basically what you do is you would schedule, send, and receive text messages through a commercial company, and the one that I use in my research is messagemedia.com, and I'll show you a screenshot from them in a second. Now the advantages of this is that it's cheap and easy, and it's quite low cost. So a typical study would be under $500 here. So a cost estimate might be 5 cents per text to send, times, let's say, 6 texts a day across a 7-day period. That's $2.10 per participant. That's $420. Now the disadvantages is this is extremely limited. You can only send them 160 characters or less. You really cannot ask too many questions unless you provide a key, and there's absolutely no options for branching or more sophisticated response timing controls. And sometimes text messaging is not going to be suitable for people who are not experienced with text messaging. I use young adults, or I study young adults, so it's not a disadvantage there. So here's the company that I use, and there's other companies out there. This is the one that I have the most experience with, and you can do a free trial with them, and they're all over the world. So they have a Australia, New Zealand website as well. So wherever you are in the world, you can probably use them. I'm not endorsed. I don't get funding from them or anything, but I am comfortable using them. So what happens is you can log on to this web SMS service and enter people's mobile phone numbers, so into groups, and you can give them ID numbers. So that's that middle column there. 666 is a participant number, and 667. So those are the participants that I'm going to be sending this text to, and then the actual text message is on the right. And this was a study of happiness, and you can schedule the messages in here. So in this study I did 6 texts a day, and you can schedule them to go out. Now it's quite challenging to schedule all those messages, but it's all done online, so you're not texting them with your specific mobile phone. And then what happens is they receive a text, goes out, and you can see the questions right there, and then people simply reply back to the text, usually using a numeric format. So there we ask 3 questions and they reply back. So 5 on happiness, a 4 on enjoyment, and a 7 on positivity. And then that goes back to the commercial web server, and then you can download an Excel file that looks like this, where each row is a single moment. So you can see the date, the sender, that's actually the ID number. I blocked out the phone for privacy reasons. And then you could see the reply message on column D, and it also includes the original message. And you can see that at the far right of the original message, I have these text 1 of 1, text 3 of 3, text 2 of 3. That's just something that you'd want to include in there so you can know which text that they were responding to, particularly if they might be different across the day. So it's relatively straightforward. And doing that, you can get these beautiful types of data of looking at, for example, momentary happiness across a 2-week period, or pain. This type of approach is quite good for simple things. And we also see pretty good response rates with texting. So this is the compliance rate. So you can see that in this particular study, nearly 80 participants and 60 participants replied to 90 and 100% of the text. So you can see that it's quite good. So you want to choose a company with good timing statistics that records when your texts were sent, when they were delivered, and when they were replied to. Sometimes this costs more, but it's worth it to know, to be able to provide estimates for how long it took participants to reply to the text. You have to design your own sampling schedule. That's the only tricky thing here. And so because you are scheduling and sending the text, you would need to randomly choose the times that you're sending. So, and if you want to send 6 texts between 9 a.m. and 9 p.m., you would divide that into 9 equal intervals. And so you'd send the first one between 9 and 10:30, and then text 2 between 10:30 and 12. And that's just generally good practice for when you're sampling. And you would also want to relax constraints so that they don't come within 20 minutes of each other would be recommended. And that's the same for all types of experience sampling in ecological momentary assessment. And I also include the text number in the text just for data cleaning purposes. And data cleaning does take a long time, like it does with all experience sampling data cleaning. So not just with text messaging, but also with surveys. You want to watch for duplicates. Sometimes people send text twice or responding the next day. Now, as a general principle, you'll need to decide who to include in the analysis. Now, in the past, I've been only including people with a 50% or more response rate. So if we sent out 48 total texts, they would need to reply to at least 24 of those in order to be included in analysis. But there's some thinking that this might be too conservative, that especially if you're using sophisticated modeling, statistical modeling that weights people by the number of replies that they do, you could go lower. And just be consistent and report the details in your write-up. All right, the second approach is slightly more sophisticated, and it does require a smartphone. And what we mean by that is a mobile phone with internet access. And here what you could do is basically design a survey. You could either use a third-party survey company like SurveyMonkey or Qualtrics, or have your own web programmer come up with a web survey. What you need from that is the hyperlink. So you then get a hyperlink that you send to participants' smartphones. And there again, you could use the same SMS service like I showed before, Message Media, or you can use, there are some pretty cool specialized companies like Survey Signal, which I'll tell you about. Now, the advantage is this is still cheap and relatively easy and low cost. So here, if you think, Survey Signal charges 10 cents per text, so that basically just doubles the cost, but still relatively affordable. But there's good flexibility and branching, and you can do a lot of things on these surveys that you that you can't do with text messaging, and you can accommodate more larger surveys, and you can do randomization. So if I was suggesting an entry into experience sampling, it would probably be this approach, because most people, text messaging is just a little bit too simple. But if you have students who are doing small studies, or if you're doing a really large study where you need to do it on the cheap, that's fine. But this approach gives you a lot more flexibility. Now the disadvantages are that formatting these surveys can sometimes be fussy, and I'll show you an example of that. And sometimes you may need to design one survey for every single sampling moment. So because some of the survey software have restrictions that you can only complete the surveys once each mobile phone, but that may depend on the plan that you use. So what would that look like? Well, here's an example from a study that I did, where we sent people a text message and to their smartphones, and then they click here to complete the survey, and then they click on that on their smartphone, and then this brings up the web survey where we asked about their feelings right now. Now obviously this does depend on them having internet access. So there may be circumstances where that's not appropriate. And sometimes the formatting can be a little tricky. So here you can see sort of nice formatting on the left. So right now, how are you feeling, where we put the response options on the top, embedded in the question. But on the right, you can see that when we put the response options in a different way, it just didn't quite turn out the way we wanted it to. So sometimes you have to fuss around with getting that right, but that's okay. So there's two of those. Well, the two survey third-party survey softwares that you can use are, the two major ones are SurveyMonkey and Qualtrics. And so basically what you do is you need to get an account with SurveyMonkey. You could do the basic or select, but I would go with select or gold if you need randomization. So it's good to sometimes randomize your items so people don't get bored with them or don't develop a response set. You can also use SurveyMonkey and this approach of sending a single hyperlink at the end of the day for daily diaries. So that would be a good way to do that, so people can complete their daily diaries on their mobile phones or at home on a stationary computer. Now this other company that I want to share with you is SurveySignal, and I quite like this company. I haven't actually done a SurveySignal study, but I will be doing one next year. And what I like about it is that it's an experience sampling kind of company. So so you still design your survey through a third-party service, but then you use SurveySignal as the signaling or text messaging system. And so you can design a signal contingent or an interval contingent sampling protocol inside SurveySignal. So you can see this here, that they can do single or repeated measurements of flexible, fixed, random, or mixed schedules, and they will send. You design the experiment, and then you can use this system to send out the surveys. And it's a fairly straightforward pricing system. They cost 10 cents a text, so you can figure that out for your budget. Let's say if you're writing a grant, it's relatively easy to know what it's going to cost, plus the cost of your web surveys. And you can also use SurveySignal to combine with intake and follow-up surveys, which is quite good. So if you have an initial baseline survey with demographics and other kinds of variables, then you can do that within this. Now, some hints. It doesn't matter what type of smartphone you have for that, so that's an advantage. It doesn't matter if a person has iOS or Android. You use people's own smartphones for this. However, you need to decide whether your population has smartphone access. So there's still some concerns about inclusiveness given population differences in smartphone usage. So here's a great internet resource. So the Pew Research Center does an annual survey of smartphone usage. And you can, here's the latest stats in 2014. You can see that there's not much differences between in men and women or ethnicity, but you see striking differences in smartphone usage in terms of age group. So if your age group is 18 to 29, you're pretty much set and about using smartphones. However, if you're doing a study on people ages, even in the upper 40s and starting at age 50, you're going to have some issues with equity and access. And you can also see these differences in education level and household income. So it's always a good thing to check in with that to know whether or not you can use smartphones, or assume that the population you're studying will have smartphones. So if they don't, then you're going to need to do something different, or like a paper survey, or provide them with a smartphone of some sort. Okay, Josh, anything you want to add before we go on to before I hand this? I think I'll hand this over to you now with with these specialized applications. Anything else you want to add?
No, you're covering it beautifully.
Okay.
I think the last, which is on the one hand in some sense the most sophisticated but also the most challenging and difficult approach, is to have applications or other specialized software that is resonant on the phone. And as noted, this could be sort of generic tools, or there are some apps and programs that are developed for ESM. The nice thing about them is, you can build it to do exactly what you want. And so, this idea of it being configurable to your specific needs, the nice thing is that when the software is resident on a smartphone, the smartphone is a pretty sophisticated device, and it can do a lot of other stuff. So it has at least some proxies for physical activity. It can do GPS tracking. It can Bluetooth or near field communicate with other devices that might be assessing physiology, and so you could start to merge multiple streams of information in ways that are really exciting. As you heard Tamlin mention, one of the issues is there are people, believe it or not, who live in places where they don't have good cell phone reception and certainly not good internet data connection. And so for some of those people, or for people who work in a big concrete building and other things, you might be surprised at the number of people who can't get a sort of a reliable internet signal. The disadvantages are it's just much more difficult to get set up and started. So you have to get the software on the phone. If you're working through an app store, either the Apple, Android, or the emerging Windows app stores, there's some issues with that. If you're trying to sort of push software out, you have some issues around people using different kinds of phones, different operating systems, different versions, and so there are some real development and maintenance costs to try to push this out to a wide group. You heard Tamlin mention in passing that one alternative to trying to use individuals' own smartphones, and this is the approach we generally take in my work, is to sort of circumvent that by providing everyone an identical phone. That obviously is a bit cumbersome in the sense of they're having to carry a second device, but it gives you a lot of benefits that you know exactly what you're working with. Everyone has the same display screen, the same processing speed, all of the things like that that are homogenized. The costs vary tremendously, but as you can see, they're considerably more than using these other solutions. So this might be limited to circumstances where you have grant or other support to run your studies. Obviously, if you're purchasing or renting phones, that's an additional cost in the data plans and things like that. There are a number of open source solutions. So the NIH Mobile Health Network, PACO is Personalized Assistant something or other from Google. There are others. There's one from Northwestern called Purple Robot, if memory serves on the name. And these are sort of free development tools that you can use to build your own software. This will save you money, but takes considerably more time and requires programming expertise. And again, that's a judgment call on, sort of whether you think that's something that you can manage on your own or not. Here we have listed some. This is not an exhaustive list, but it's several of the sort of both generic and specialized software. I think we have some examples of some of these on subsequent pages. You can obviously have access to these, and then Tamlin has a nice list that she, I think, is still keeping updated that's linked at the bottom there.
So I'll talk about this. So just as an example, MEMA is a commercial company out of Massachusetts. The company name is IllumaView, and they have been developing pretty good iPhone, so iOS and Android applications that are pretty much ready for prime time. So they will help you to create your online survey and deploy it and make it available for your participants to download. And so this would be a good, reliable commercial company to use if you were in North America. There's other companies in Europe, but actually going back to this, the Movisens XS is in Europe, but they only do Android, so you have to be careful with that. So this MEMA is quite good. They started off just being on the iOS, iPhone, iPod Touch, and iPad platforms, but now they've moved to Android. So that's really good. If you're going to be using participants' own mobile phones, it's better to get a software tool that can run on both platforms. Another one is ESM Capture. Now this is only on for Apple products, iOS. However, it might make sense if I could imagine people getting a fleet of 20 iPod Touches and installing ESM Capture on those iPod Touches and giving those out to participants. That might be another solution, but again, this would most likely require grant support. Josh, you want to talk about the DREAM initiative?
Sure. This is our internal efforts to build up the sort of software and infrastructure support here at Penn State. We do Android only. Again, you've heard, it's challenging to develop and support across multiple platforms. And this is housed within our Survey Research Center. One of the most notable things here is we custom build the software for every project and also work with, we happen to have a deal with Verizon at the moment, but we do sort of device purchasing and device rentals and manage data plans for projects. And so we're sort of the most high touch of these listed. We sort of do a lot of stuff on the back end that to support the work, so you don't have to spend your time. Our particular approach is we do this all on a not-for-profit fee-for-service, so we are sadly not as cheap as we might be, but it is another sort of approach that we've taken here.
Josh, what would be a pricing estimate? I mean, can I ask you that?
Yeah, it depends on the length and what typically is getting done in terms of number of phones, but the development and implementation of the software is somewhere probably between 3,000 and 8,000 for a sort of a reasonably sized study, so 50 or 60 people, say. Mm-hmm. And then if people are renting or purchasing phones for use in their studies, that adds on things for data usage and phone rental. One of the nice things that we've been able to do is we've built in a lot of support for parallel assessment processes. So we've built cognitive assessments, physiological assessments, GPS tracking. You can see from our icon the kinds of things we think about, self-report and physiology, activity, and positioning. And so, these are harder for some of the other solutions to manage at this time.
Right, absolutely. Oh, that sounds great. All right, so there's a few implementation barriers and limitations, and one is the high startup costs. So literal and figurative, meaning that there's not just monetary costs, but cost to time, costs for people to help you. And the study, design, and device and programming, all of this requires a lot more time and investment. It's like, I think of experience sampling and EMA as a multiplier of things. So it multiplies the cost and the startup, but it also multiplies the benefits that you get from it. So you get a lot of data and then a lot of headaches as well. It's also not necessarily or efficient for assessing rare experiences. As Josh mentioned before, you really need to think about the time scale of your processes that need to match the assessment. So, and then not finally, but there's also many limitations of self-report measures that still apply to EMA self-report. So even though you're measuring people's experiences in the moment, there may still be some social desirability there. What's really exciting is that there's more and more chance for doing cognitive testing and indirect or implicit measures while people are out in their everyday environments. And that's only recently that people have been able to do cognitive testing. As Josh mentioned, the DREAM can accommodate. And the statistical analyses are hard, and they require specialized training and knowledge. For example, multi-level modeling is probably the first type of statistical knowledge that you need, because it takes into account the nested data. That is, you have multiple observations per person, and you can't use traditional approaches for that because it violates the assumptions of independence between each of the observations, because you have dependency between observations for a given person. Josh, do you want to add anything about this?
You know, this could be an entire other webinar on how to do this, and I think, you know, sort of we're lamenting in some sense these challenges statistically, procedurally, practically, not to be downers, but I think, you know, we want people to go in with their eyes open, and back to that early statement of, you know, best to collaborate where possible. And if you're not an expert methodologically, you know, one bit of advice is to find some collaborators who have the requisite skills to manage and analyze these data correctly.
Mm-hmm. Mm-hmm. So I don't know if we want to spend too much time on these issues because we want to leave time for questions, but one thing, you are going to get these slides later, so you can go back and read through them. Just a couple points here is, people often ask, well, is there any evidence of reactivity? So this is the bottom point here. Mostly reactivity means, is the very process of having people to track their experiences, does that change their experience? And for this, I'd recommend a great chapter in the handbook that we'll reference later that reviews the general scope of the evidence to suggest that there's mostly little evidence of reactivity, unless you do a couple things wrong, unless you recruit people who want to change. So if you want, you know, if you're recruiting a study of happiness and you say, you want to be happier, come take part in our study, then you're going to see people probably who are a bit more reactive. And then also if you only ask a limited range of questions, so if you keep asking people about their pain, and nothing else, or their emotions or their happiness and nothing else, you might run into trouble. So that's why it's sometimes good to ask a few different types of questions so you're not focusing attention on one thing in particular. Now, just well, Josh, do you want to talk about this?
I think we've hinted at this, and in the interest of time, we don't need to go through this in great detail, but I think, you know, there are different kinds of ways to think about this, and crudely you can think about what we are calling here active collection, where a participant has to do something. Notably, we've talked a lot about self-report data, but there are ways to use other things, and you could imagine they could be taking pictures or doing things or or anything else that requires their activity. The emerging market in this sort of research space, I think, is on passive data collection, or what you can think of as automatic. And so these are other wearable devices, or using the smartphone, or other approaches that are capturing information about the person or their environment without the person having to do anything. And that gives you additional data streams of information that can be really exciting.
Mm-hmm. And I just want to make a plug here that for a new term called ecological momentary interventions. There's a great chapter by Josh, which there's the link right here. And then another very exciting emerging thing is to be using EMA to deliver interventions. Josh, do you want to talk about that at all?
Again, I think as we're running a bit late, the gist is here. It's the idea of tailoring not to an individual's fixed characteristics, but rather to moments of risk. So you provide it when it's necessary, to sort of when they might be useful, and to give them what they need at the moment of risk or need. And so it's just a way of using these rich data streams to inform the development of what you've also perhaps heard of as just-in-time or adaptive intervention content.
Yeah. And just lastly, a quick plug for the society that both Josh and I are members of. It's called the Society for Ambulatory Assessment. And so if you're interested in these methods, we have a conference coming up next year, June, and that Josh is hosting. And there's a website right there, and you're still in time to submit abstracts, which would be January 30th, 2015. So thank you very much.
Sorry, it took me a moment to get unmuted. Thank you so much, Caitlin. That was fantastic. So we only have a few minutes left, as you noted. That was a really thorough presentation, though, so I'm sure that was helpful. Do you mind if I send the slides out to the listserv?
That's fine, yeah.
Or we can chat about that via email. So
yeah.
So if you're listening and didn't have a chance to quite take all the notes you wanted to take, I'll be posting the video/audio, so the recording of this webinar, which will be sort of a YouTube link, including the slides and also the sound, and then we can also send the slides if that would be helpful. I just have a quick question, if no one else has sent any, if you don't mind, and that is, how do you deal with paying participants? Do you typically, I don't know, how much do you pay them, kind of on average? Do you connect it to how often they respond to these sorts of questions?
Yes, and yes. I pay participants. When I can't get them through a subject pool at my university, I do pay them. And for my daily diary research, I do yoke payment to the number of diaries that they complete. For the text messaging, I have such high response rates, I don't need to do that. I just pay them. I pay them, a fixed amount. But I do incentivize where possible. So, for example, if they complete 85% of the text, they get an additional $5 bonus.
Oh, nice.
So, and then I might pay, $1. It's the New Zealand dollars, $1 or $2 for every daily diary that they complete. So yeah, I do pay.
This is probably a tough question because I'm sure it depends entirely on the study and the time burden, but can you give kind of a range of what you feel like it takes to maintain, a good level, low level of attrition?
I can take a stab at that if you want.
Yeah,
again, just to get back at sort of, you can think about what their total estimated participation time would be. So if it's a 1-minute text message and they have to do 100, they're spending roughly 100 minutes. And so that gives you just some crude sense of where to start. And I strongly echo Tamlin's approach, of some incentive. I will say that some IRBs are unhappy with a total linkage of payment to participation, and so what we often do is a hybrid where a participant will get $20 to participate and then an additional $20 if they do X, Y, or Z. So you can break it up into units of compensation, that each of which might be differentially contingent on their participation.
Okay.
Yeah, I agree. And just as a rough range, the studies that I've done, the payment has ranged anywhere between $20 and $70 for a 1-week to 3-week study. But working backwards from the total amount of time that they're required and not making everything contingent upon their participation is a good idea.
Yeah, that makes sense. And I've run into those sorts of IRB issues as well. There is a question here. I'm just trying to be able to read it. Here we go. Okay, so really quick before we wrap up, we have one question. Question is, this person who's asking is new to this methodology, as am I. And so she asks, what do you suggest in terms of how to get trained up to kind of get going on your first EMA study, and maybe what would you recommend in terms of pursuing collaborators or resources? Obviously, you have some great papers here and books here as well.
I would start with a little pilot study. You know, I would just get right in there and start with a you know, mobile survey and you know, run a small study of 40 people, you know, even 20 people, just to get used to it, and pilot test your measures. Unless it's a very complicated thing that you want to do then you might want to start off with collaborators. But what do you think, Josh?
Yeah, I think if you have the luxury to play a little bit, I think that's a great idea. Do some text messaging, do some mobile optimized surveys through SurveyMonkey or Qualtrics to get your feet wet. I think if you happen to have access to colleagues you know, at your institution or elsewhere that have done some of this, it can save you a lot of hassle to get some feedback early on. On the screen that you have now, you'll see a number of excellent resources, and in particular, I think in the 2012 handbook, there are a lot of sort of practical chapters that can help you get off the ground.
Yeah.
At the SAA conference, I will put in one more shameless plug for that. One of our pre-conference workshops on June 24th, 2015 will be an EMA boot camp, and it will be designed to get people who are not familiar with the methodology sort of up and running with some hands-on sort of training and practice to do that. So
yeah, that's great. That's great.
Yeah, that sounds like a fantastic resource.
One, just quickly, that Connor and Lehman 2012 Getting Started chapter in the handbook, there's going to be a link to that, so you don't actually, that would be a really great place to start. So It's really, really a good starting place for people.
Fantastic. Thank you so much for making that available.
Yeah.
Great. Well, I think we are out of time. Thank you guys so much for your presentation, and thanks to the audience for listening. I'll be sending out an email soon with the link to the video of this and some information about some possible topics that are coming up in the winter and spring after the holidays. So everyone have a fabulous holiday, and thank you so much for attending.
Great. Thank you.
Thank you all.